If one pill lowers your blood pressure, why would your doctor add another? For millions of older adults, the answer comes down to balance. Two medications, two different paths, working toward the same goal. High blood pressure rarely has one simple cause. That's why many treatment plans rely on a combination of medicines, like Amlodipine and Losartan. Together, they don't just lower the numbers on the monitor, they protect your heart, your kidneys, and your arteries over time. And the data backs this up. Studies show that 72% of patients reach their target blood pressure, below 130/80, when using this combination. Compare that to just 45% with a single drug alone. That's better control, fewer complications, and more consistent protection throughout the day. But how do two medications work together so effectively? And why is this pair often chosen for older adults? Here's what makes it work. These two drugs operate in opposite ways, yet they complement each other perfectly. One relaxes the blood vessels quickly. The other works more slowly but goes deeper, protecting organs and stabilizing the system from within. What that gives you is a faster drop in pressure, plus longer-term benefit to your kidneys and heart. In this video, we'll walk through why doctors often pair Amlodipine and Losartan, how the combination works in your body, and what side effects or interactions you should watch for. We'll look at real-world data, explore how this applies to older adults and caregivers, and highlight what you need to know, whether you're taking these medicines yourself or caring for someone who is. Disclaimer: this video is for educational purposes only. It is not medical advice. Always talk to your doctor before making any changes to your medication. So let's begin by understanding what each medication does and why one alone isn't always enough. When you take a blood pressure pill, it's easy to assume they all do the same thing, lower your numbers. But the reality is more nuanced. Each medication targets a different part of the blood pressure system. Let's start with amlodipine. It belongs to a group of medicines called calcium channel blockers. Calcium is what helps your blood vessel walls tighten and contract. Amlodipine blocks that calcium from entering the muscle cells of your arteries. Without that calcium signal, your vessels relax and widen, a bit like opening up a narrow pipe so blood can flow more freely. This relaxation happens mainly in the outer arteries, which means it quickly lowers the pressure your heart has to pump against. That's why amlodipine often gives faster results, sometimes within the first week of treatment. Now, Losartan works from a completely different angle. It's part of a class called angiotensin receptor blockers, or ARBS. Instead of relaxing the arteries directly, Losartan blocks a hormone in your body called angiotensin II. That hormone normally tells your vessels to tighten, and your kidneys to hold on to salt and water. Both of those raise blood pressure. By blocking that message, Losartan helps the vessels stay relaxed and prevents fluid overload, easing the strain on both the heart and the kidneys. It doesn't act as quickly as amlodipine, but its effects run deeper, protecting organs over the long term. So here's a simple way to think about it. Amlodipine opens the pipes. Losartan reduces the pressure inside those pipes. Each targets a separate part of the same system. One focuses on the arteries, the other on the hormones and kidneys that regulate pressure. That's why doctors often combine them. Amlodipine lowers the pressure from the outside, and Losartan keeps it stable from within. Clinical data supports this synergy. On average, amlodipine lowers systolic pressure by about 10 to 15 millimeters of mercury. Losartan reduces protein leakage from the kidneys by 20 to 35%. When used together, blood pressure can drop by 25 to 35 millimeters of mercury, a stronger and more balanced effect than using either drug alone. The key, and here's the key, when used together, they don't fight each other. They fill in each other's gaps. One works fast, the other lasts long. One opens vessels, the other protects organs. Together, they form one of the most trusted combinations for managing high blood pressure, especially in older adults. When two medications target blood pressure from completely different directions, the result isn't just stronger, it's smoother. Amlodipine and Losartan are designed to complement each other perfectly. Amlodipine acts on the surface. It relaxes and widens the arteries, reducing the tension your heart feels every time it pumps blood. Losartan works deeper. It blocks a hormone called angiotensin II, which normally causes blood vessels to tighten and the kidneys to retain salt and fluid. By silencing that hormone, Losartan reduces the internal pressure that pushes against artery walls and protects delicate kidney filters from long-term strain. It's like turning down the pressure and widening the pipes. Two different levers, one steady result. Together, these effects create a more stable blood pressure pattern throughout the day. Instead of sudden highs in the morning or sharp drops at night, the combination helps your pressure stay in a healthier, more consistent range. And that smooth control matters, because large swings in blood pressure, even if the average looks normal, can increase the risk of stroke, kidney injury, and heart failure in older adults. In clinical studies, this dual approach shows powerful results. Blood pressure typically drops by 25 to 35 millimeters of mercury when the two are combined, more than with either drug alone. Amlodipine contributes a rapid fall in systolic pressure within the first 1 to 2 weeks. Losartan, meanwhile, reaches its full protective effect over 1 to 3 months, especially in the kidneys and heart. The result is balanced control, fast improvement that lasts. But the benefits extend far beyond the numbers. According to analyses summarized by the National Institutes of Health and the Mayo Clinic, angiotensin receptor blockers like Losartan reduce protein loss in the urine, a key sign of kidney protection, by as much as 30 to 40%. At the same time, calcium channel blockers like amlodipine improve arterial compliance, the ability of your blood vessels to stretch and rebound, by about 20%. That means less stiffness, better circulation, and reduced strain on the heart muscle over time. In fact, long-term studies in patients with chronic kidney disease and hypertension show that the amlodipine-losartan combination can reduce the risk of kidney failure progression by nearly 20 to 25% and lower the rate of stroke and major heart events by 15 to 30%. These are not just short-term improvements. They're protective changes that accumulate with each month of consistent therapy. So when your doctor prescribes both, it's not about taking more medicine. It's about using precision, targeting the blood pressure problem from both the arteries and the hormones that control them. Two mechanisms, one steady outcome. And for many older adults, that means a longer, safer, and more stable path to heart and kidney protection. Here's what many patients find surprising. The combination can actually reduce some side effects when balanced right. Let's start with the common mild effects you might notice. With amlodipine, the most frequent complaint is swelling in the ankles or feet, known as peripheral edema. It happens because the arteries relax and widen, but the veins don't always expand at the same rate. That small mismatch can cause a bit of fluid to collect in the lower legs. On its own, amlodipine can cause this in up to 16% of patients, according to Mayo Clinic data. Now, Losartan works differently, and that difference is what helps balance things out. Losartan slightly increases salt and water excretion through the kidneys, which means it can actually counteract some of that swelling. When the two drugs are used together, studies show the rate of ankle swelling drops to just 2 to 5%, roughly a 70% reduction compared to amlodipine alone. That's a clear example of how one drug's mechanism can offset another's. Another mild effect is dizziness or lightheadedness, especially in the first few days. This happens when blood pressure dips a bit faster than your body is used to. It's more common in older adults or those who stand up quickly after sitting. In most cases, this feeling improves as your body adjusts. But if dizziness is persistent or causes near fainting, it's worth checking with your doctor to rule out overlowering of blood pressure. So while both medications can cause mild effects, combining them doesn't double the risk. It actually creates a safer balance. Amlodipine lowers pressure through artery relaxation. Losartan stabilizes kidney function and prevents fluid buildup. Together, they produce smoother control, with fewer abrupt changes in circulation. Still, there are a few rare but important side effects to know. Because losartan reduces the hormone angiotensin II, it can occasionally raise potassium levels in the blood, a condition called hyperkalemia. This is more likely in people with kidney disease, or those taking potassium supplements, certain diuretics, or salt substitutes. Symptoms include unusual fatigue, muscle weakness, or irregular heartbeat. If you notice any of these, contact your doctor right away. A simple blood test can check your potassium level. Another concern, though uncommon, is low blood pressure, or hypotension. This can cause sudden dizziness, blurred vision, or fainting, especially when starting treatment or increasing the dose. Monitoring your blood pressure regularly, particularly in the first month, helps your doctor fine-tune the balance. Most patients tolerate this combination very well, especially when started at a low dose and adjusted gradually. That's why doctors often begin with a single combination tablet that delivers both medicines in smaller amounts, like 5 mg of amlodipine with 50 mg of losartan, and increase only if needed. According to recent data from the NIH and real-world safety studies, Li et al. 2021, Zhang et al. 2025, the overall discontinuation rate for this combination is just 5 to 10%, compared to 15% or more for single drug therapy. That means most patients not only tolerate it better, they stay on it longer and achieve more stable results. Here's what to watch for. If you notice swelling, monitor it, but expect it to improve over time. If you experience dizziness, stand up slowly and report any persistent symptoms to your doctor. If you feel unusual fatigue or muscle weakness, ask your doctor to check your potassium levels. And if you have severe or persistent lightheadedness, call your doctor right away. Used correctly, this combination is not just powerful. It's one of the most balanced and well-tolerated approaches to controlling high blood pressure in older adults. For many seniors, this pairing offers steady pressure control, without the cough or fatigue seen with older drugs. As people age, blood pressure becomes more difficult to manage. Arteries stiffen, kidney function slows, and the body's natural rhythm of blood pressure, the rise in the morning and dip at night, becomes less predictable. That's why doctors often reach for combinations that provide smooth, all-day stability. The partnership of amlodipine and losartan has become one of the most widely used for older adults, and for good reason. Amlodipine relaxes the arteries, making it easier for blood to flow. Losartan blocks the hormonal pathway that causes those same vessels to tighten. Together, they reduce both the pressure on the surface and the tension inside. The result is consistent control with fewer spikes or drops, exactly what the aging heart and kidneys need. Heart and kidney protection. This combination does more than lower numbers. It protects organs that are most vulnerable with age. For the heart, losartan helps reverse left ventricular hypertrophy, the thickening of the heart muscle that happens after years of high blood pressure. Studies show a 15 to 20% reduction in heart muscle strain when ARBs are used long-term. For the kidneys, amlodipine improves circulation in the small arteries, while losartan reduces protein leakage, a key marker of kidney damage, by up to 30 to 40%, according to the National Institutes of Health. Together, they lower the risk of kidney disease progression by about 20 to 25%. And for stroke prevention, by keeping systolic blood pressure steady, usually lowering it by 14 to 20 millimeters of mercury. This combination cuts the risk of stroke and heart attack by as much as 30%. Fewer side effects than older drugs. One of the biggest reasons this combination is favored in seniors is its cleaner side effect profile. Older blood pressure drugs like ACE inhibitors, for example lisinopril or enalapril, can cause a persistent dry cough in up to 10% of patients, sometimes enough to stop treatment altogether. Losartan, being an ARB, avoids that problem entirely because it blocks the angiotensin pathway without interfering with bradykinin, the chemical that triggers cough. And unlike some beta blockers, neither amlodipine nor losartan commonly causes fatigue or sluggishness, making them easier to tolerate in day-to-day life. Backed by major guidelines. This combination isn't just common. It's officially recommended by leading authorities. The 2025 AHA/ACC hypertension guidelines list an ARB plus calcium channel blocker as a first-line dual therapy for patients whose blood pressure remains above target despite one drug. In older adults, it's especially encouraged because the medications are gentle on the kidneys, don't interfere with heart rhythm, and work well even when metabolism slows with age. Real-world studies, such as the multi-center analysis by Lee et al. 2021, confirm higher adherence rates, about 30% better than taking separate pills, and fewer discontinuations due to side effects. In short, for seniors who need steady control, kidney protection, and fewer medication burdens, the amlodipine-losartan combination offers one of the safest and most effective long-term options available. It's a modern approach with an old-fashioned goal: keeping your heart strong, your kidneys protected, and your days steady. Where routine matters more than the clock, consistency is what keeps blood pressure stable. When it comes to amlodipine and losartan, the most important rule is simple: take them at the same time each day. Whether you take them together or separately doesn't make a major difference. What matters most is being consistent. For most patients, doctors recommend taking both in the morning because that's when blood pressure naturally rises. Morning dosing helps cover the daytime hours when your heart and arteries are most active. But if you notice lightheadedness or ankle swelling later in the day, your doctor might shift one dose. For example, amlodipine in the morning and losartan at night. There's no universal rule here. It's about what keeps your blood pressure smooth and your symptoms minimal. How to take them. Both medicines can be taken with or without food. Food doesn't significantly change how your body absorbs either one. So if breakfast helps you remember your pills, take them with breakfast. If you prefer evenings, set a consistent time and stick with it. Consistency, not the clock, is the key to steady control. If you're prescribed a combination tablet that includes both amlodipine and losartan, that makes things even easier. One pill, once daily. Most fixed-dose combinations come in doses like 5/50 milligrams or 10/100 milligrams. Your doctor may adjust the strength after 2 to 4 weeks, depending on how your blood pressure responds. Watch for interactions. While both drugs are well tolerated, they can interact with certain supplements and over-the-counter products. Potassium supplements or salt substitutes can be a concern. Losartan can increase potassium levels, so adding extra potassium can raise the risk of hyperkalemia, high potassium in the blood. Avoid salt substitutes unless your doctor specifically approves them. NSAIDs, like ibuprofen or naproxen, are another consideration. Regular use may reduce the effectiveness of losartan and increase the risk of kidney strain, especially in older adults. And if you're taking diuretics or water pills, be aware that some lower potassium, like hydrochlorothiazide, while others raise it, like spironolactone. When taken with losartan, your doctor may check your electrolytes more often to keep them in balance. According to the Mayo Clinic and AHA-ACC 2025 guidelines, keeping potassium between 3.5 and 5.0 milliequivalents per liter is the safe zone for patients on ARBs. Monitoring kidney function and electrolytes at 1 month, 3 months, and 6 months is standard for older adults on this therapy. A note on polypharmacy. Many seniors take 5 or more medications, not just for blood pressure, but for diabetes, cholesterol, or heart rhythm issues. That's why managing timing and avoiding mix-ups is crucial. Use a pill organizer or reminder app to keep track. And if you ever start a new medication, even something over the counter, check with your doctor or pharmacist before combining it with amlodipine or losartan. Here's what to remember. Be consistent with your timing. Avoid unnecessary supplements. And tell your doctor about every medication you take. 2 simple pills, 1 steady routine, and a safer, more stable blood pressure every day. So, let's bring it all together. The reason doctors often pair amlodipine and losartan isn't because your blood pressure is getting worse. It's because these 2 medicines work in complementary ways, balancing each other to give you steadier, safer control. Amlodipine opens up the arteries and helps blood flow more freely. Losartan blocks the hormones that tighten blood vessels and damage the kidneys over time. Together, they target both sides of the pressure problem, the surface and the system, for a smoother pattern across the day. That's why studies show patients on this combination are far more likely to reach healthy blood pressure targets, with fewer side effects than when using higher doses of a single drug. And for older adults, this balance matters even more, helping prevent strokes, protect kidney function, and ease the strain on the heart. If your doctor prescribes both, it doesn't mean your condition is worsening. It means your treatment plan is becoming more precise. 2 medicines working together can control pressure more effectively, and even lower the risk of complications in the long run. Just remember a few key points. Take your medications consistently, at the same time each day. Avoid potassium supplements or salt substitutes unless your doctor recommends them. And report new or persistent symptoms early, like swelling, dizziness, or unusual fatigue, so your dose can be adjusted safely. Managing blood pressure isn't about perfection. It's about progress and protection. And with the right combination, your numbers and your organs can stay more stable for years to come. Question for you. Are you currently on both amlodipine and losartan? How has it worked for you? Share your experience in the comments below. Your story might help someone else. And if you found this helpful, don't stop here. Watch our next video. Foods to avoid when taking losartan. It covers the most common foods and supplements that can interfere with your medication. This is MedDose Explained, where medicine meets clarity.